This recording is going to cover the basic anatomy of the respiratory system. It's going to help you when you look at structures in the lab. Now, before I kind of look at some of the basic structures associated with the respiratory system, I do want to talk about some of the functions. Most people, when they think about functions of the respiratory system, is definitely gas exchange. You want oxygen to come in, you want to get rid of carbon dioxide. And there's a number of processes involved in this whole ventilation, respiration function. We'll talk about that mainly in lecture. Now, but the respiratory system is also important in sound production. That's what phonation is. So phonation is the production of sound. So things like the larynx, your voice box, that is going to be important in sound production. But other structures all contribute to the quality of the sound or how it sounds, like your the nasal cavity in general, your sinuses, the resonating chambers for speech. So it does involve the respiratory system is important in sound production. It also, you learned in A&P1, is its role in smell. The sense of smell is olfaction, or olfactory receptors are found within the nasal, lining the nasal cavity. But one interesting thing is the respiratory system is also very important in acid-base balance. The changes in respiration can be a means of regulating or controlling acid-base balance. So we'll look at that a little bit later. But also problems with gas exchange, or if you hyperventilate or hypoventilate, that themselves can cause acid-base imbalance. Now, you've already kind of looked at its role, kind of indirect role in blood pressure regulation, because the angiotensin converting enzyme is produced in the respiratory tract or in the as part of the respiratory system, and that plays a role in acid-base balance, in blood pressure regulation, blood volume regulation, because it converts angiotensin 1 to angiotensin 2. So you looked at that previously. So what I want to do is I want to kind of show you, look at the respiratory tract, and we're going to break it up into two divisions. So we have an upper respiratory tract, which is anything superior from the larynx. Larynx on down is the lower respiratory tract. So let's look at the upper respiratory tract first. So the upper respiratory tract overall, its main functions would be 1, sense of smell. 2, it's going to be involved in speech, resonating chambers for speech, because I want you to think about it when you're stuffed up, you sound different. So that plays a role. But also, the most important role it plays is it's an air conditioning function. It's going to help to warm, humidify, and filter out the air. We want to make sure the air, by the time it makes its way down to the respiratory membrane, where you have the alveoli, which is very delicate, we want to make sure the air is warm, not too cold. You want to moisten, that's humidification, and you want to filter any large debris, and you want to make, because you want to protect the alveoli. So we're going to look at some of the structures and kind of their role in the different parts of the respiratory system. So we're going to start with your external nares. Your external nares you think of as your nostrils, but you have to call them external nares. We're going to use proper anatomical terms. There is such a thing as internal nares, so you have to make sure that you call these external nares. Now, once you pass the external nares, you're going to be in this region right here, which is called the vestibule. The vestibule is got large hairs, which help kind of protect against large particles from entering the nasal cavity. But what's interesting is that vestibule is actually lined by the same epithelium as your skin, which is stratified squamous keratinized epithelium. It's not until you get to the nasal cavity proper, which is up in here, where you have a different type of epithelium. Now, it's that nasal cavity is lined by mucous membrane, and the epithelium that's part of that is PCCE, pseudostratified ciliated columnar epithelium, which will play a very important role in humidification and also filtering, because you have that cilia. You've got mucus that trap debris, and you have cilia that beat, that if something's up in that nasal cavity, we can trap that debris, and the cilia will beat, and you'll swallow it, and you'll destroy that by your stomach acid. Now, if we kind of look here, within that nasal cavity, we're going to have kind of separating the nasal cavity from the oral cavity is you have here is the hard palate, which is bone, and then you have the soft palate. Now that little thing that hangs down the back of your throat, this right here is the uvula, okay? So let me erase this so it makes it easier to see. Now what we'll have is one of the things that are very important is you have this thing called nasal concha. And I'm going to come back here with this coronal section, and you see the concha, which are also referred to as turbinates. So you see them here, here, and here. They look like little turbines. Now there's a superior nasal concha, middle nasal concha, and you have inferior nasal concha. So you see them on either side. Well, these guys are lined by, again, mucous membranes, and what happens is they play a very important role in kind of creating turbulence as the air comes in. It helps to warm up the air. Larger particles will actually filter down, and as the air becomes more turbulent as it comes in. Now, what's interesting, or something that you kind of should realize, we're going to tie a little AMP1 in, is the superior and middle nasal concha are actually part of the ethmoid bone. So in this picture, you see the green, that's depicting the ethmoid bone. And you see the middle nasal concha here, the superior, we have to pull up the nasal bones for you to see it, but those are actually part of the ethmoid bone. The inferior nasal concha you see right here. Those are their own separate bones. You should have learned that in AMP1 about the ethmoid bone, the inferior nasal concha. So you have one ethmoid bone, but you have two inferior nasal concha. Now, on the one model, is you see them here. Here's this A is the superior nasal concha, B is the middle, C is the inferior. Now, in between them, you see the little passageways, and I'm going to do it in green. There's one, there's two, there's three. The top one is the superior nasal meatus. Meatus means kind of a passageway. The middle one right here, nasal meatus, and the bottom one is the inferior nasal meatus, okay? Now we also, on this picture, I want to bring your attention to a couple other things. Is you have the opening to the eustachian tube, and right here. So you learned about the eustachian tube, or what some may refer to as the auditory tube, when you learned about the ear. So that eustachian tube was important in equalizing pressure from the outside, from the tympanic membrane, the inside, and normally that's kind of kept closed, but if it opens, we can help to equalize pressure to help with hearing. So that's actually the opening into the pharynx for the eustachian tube. So you notice how important is that it's easy to get a middle ear infection if you have an infection here, because it can travel up into and get it into the middle ear. Also on this picture, you're going to see a couple of the tonsils. So you have your pharyngeal tonsils right here, and you have your palatine tonsil right there. So those are important, and again, when you're having air coming in to filter out debris, any pathogens to mount an immune response, so we don't get any respiratory infections. Now, another thing I want to bring your attention to are the paranasal sinuses. Now, looking at an x-ray of the skull, you'll see kind of these light areas in here. And they're just air-filled spaces in various bones of your skull. And they're lined by mucous membranes too. And they believe that one of the roles of this is it helps to lighten the weight of the skull. They also contribute as resonating chambers for speech. But most of us know if we get our sinuses, or like you get a lot of sinus pressure, just makes your life miserable. But these air-filled spaces are found in certain bones of your skull. So if you remember your skull bones, it's easier to be able to identify the paranasal sinuses. So you have your frontal sinuses, which are going to be found up here in the frontal bone. You have your sphenoidal sinus, which you see here in the yellow, and here's another thing. So remember, I always call it the bat bone. You have some air-filled spaces as part of the sphenoid bone. The ethmoidal sinus, which you see in kind of the lavender color, is you have some air-filled spaces as part of the ethmoid bone, and you also have maxillary sinuses. And here's one of the maxilla here. So the you have air-filled spaces in the maxilla too. Now on this one model, you can actually see a couple of them. So here's a frontal sinus here. This right here is a sphenoidal sinus, so you can at least see them on those models. There'll be another model in lab that will depict the sinuses, and so you should be able to identify them based on where you know where the different bones of the skull are. Now another thing I want to look at, which actually corresponds or is going to be related, so actually I'll show you this on the picture that you have in your lab notebook, is here's the frontal sinus. Here's a maxillary sinus, but you're going to have them on both sides, so they would be over here and here. This here, these represent your ethmoidal sinus, and here is the sphenoidal sinus, okay? So that's what those are depicting. Now, I want to talk about the pharynx. When you think pharynx, you think throat. The pharynx is actually divided into 3 regions, and they'll be important in knowing these when you do digestion too. Now, the first part, the most superior part, which you see in green here, is the nasopharynx. Now, we should have only air going through this. This is lined by PCCE. So when you swallow, we shouldn't have liquids or food going up in there as everything works out okay. Unfortunately, sometimes things get up there, but we should only have PCCE there. We don't need any stratified epithelium because the air is not going to do anything and will the constant wear and tear away the epithelial cells. However, in the yellow and the blue, those 2 areas are lined by stratified, squamous, non-keratinized epithelium. You have to have multiple layers of epithelial cells because both of these regions are going to be involved in swallowing food, which could cause a lot of wear and tear. Now, they're non-keratinized because they're moistened areas. So the yellow is the oropharynx. So when you open your mouth up and say, ah, I'll be seeing your oropharynx. So you see it right here. And then in the blue is the laryngopharynx. Now what you'll notice is when you swallow food, you want the food to go down the laryngopharynx into the esophagus. You do not want it going here, because if it gets through this little hole here, which is referred to as the glottis, you'll choke. And we don't want any of that thing going down into the airways and blocking any airways. Great. Luckily, we do have a very strong choking reflex. We'll try to get that stuff out, but we try to avoid that stuff going down in there. And what we'll have is when we swallow, one of the things that are going to happen is the larynx, which you see part of it right here, will elevate, and this structure here called the epiglottis will cover, and it'll cover this glottis, because epi means upon, so food doesn't go down into the airways. And we're going to look at that structure of the larynx very shortly. Now the larynx is part of the lower respiratory tract. The larynx, the trachea, your bronchi, your bronchioles, your alveoli, those are all part of the lower respiratory tract. We'll continue to try to make sure we humidify and moisten and filter out that air. And then when we get down to the alveoli, that's where gas exchange is going to take place. Now the larynx is also involved in sound production. So let's look at the larynx first. And the larynx on this model, you can see part of it right here. Okay, so this would be the larynx. So let's look at the larynx. So on this here, the larynx goes from here up. This here is part of the trachea, so that's not part of the larynx. Now the larynx has 9 cartilages associated with it, which is going to be important. So the first one, if we're looking at an anterior view of the larynx, this one here, the large one, is called the thyroid cartilage because its proximity to your thyroid gland. So this is your thyroid cartilage. It's composed of hyaline cartilage. This bottom one here is the cricoid cartilage. It also is composed of hyaline cartilage. Now you'll also see up here which you'll see better if we do a sagittal cut, is that this here, which also corresponds to this right here, is your epiglottis, which I just mentioned will cover up the glottis when you swallow. The glottis is, I'm going to do it in green, is this hole right there, this space. That's air needs to go through, pass through the glottis for you to breathe, but also it's going to be important in sound production. So I'm going to erase that so we can see a little bit better. Now the epiglottis has primarily elastic cartilage. It's part of it. Now the epiglottis again is covered by a mucous membrane, but we're going to talk about mainly the cartilages right now. So the epiglottis is a lot of elastic cartilage. Now we also have, so I said, okay, we've got 9 cartilages, and I've only covered 3: thyroid, cricoid, and epiglottis. Now on the sagittal section, we're going to be able to see the other ones. So what you'll see, let's do green, is right here is the cuneiform cartilage. You actually have 2 of them, one on either side, so they're paired. Cuneiform. Now the cuneiform cartilage is elastic cartilage, okay? So it's going to be primarily elastic cartilage. The next ones we have is just at the tip, right here. That is, I'm going to, because it's getting a little busy there, call them corniculate. You have 2 of them, corniculate cartilages. The corniculate cartilages are also elastic cartilage. Then we have, I'm going to change the color, is you have right here, these are arytenoid. Arytenoid. You have 2 arytenoid cartilages. Now, the part that's closest to where the corniculate cartilages are is elastic cartilage, but the majority of it is hyaline cartilage. Now, remember, cartilage is a supporting connective tissue. So the fact that we have a lot of cartilages associated with the larynx, think of it's kind of for support, for protection. It's going to give some protecting things like the glottis, the entrance into the trachea. They're also, these in some way, shape, or form are going to be attachment points for a number of muscles and ligaments. Now the thing is that the difference between having elastic versus hyaline is that elastic cartilage that is going to be a little bit more flexible, but what's most important is something that's elastic wants to go back to its original position. So if you stretch it, you move it, it really wants to go back to its original position. So a lot of the elastic cartilage, think of epiglottis, when it bends over and covers up the glottis, you want to be able to eventually go back to where it's supposed to be, which you see is right up here. Overall, in one way, shape, or form, these cartilages that are part of the larynx are going to either be involved in swallowing or sound production. Now, you'll also notice that there's these folds associated with the larynx, and the top one, which you see here, are called vestibular folds. Vestibular folds. This bottom one, right here, these are your true vocal cords. Now, when air passes through the glottis, the vocal folds will vibrate and create sound. Now, the pitch of that sound does depend on the diameter, the amount of tension that's in there, their length. So some things like anatomy, men, their voices are deeper because the sizes are different, but the amount of tension that's placed on it, I can change the pitch of my voice at will. I'm not going to do it right now, but the muscles associated, intrinsic muscles associated with the larynx can change the tension of those and change the pitch of the sound that you make. Now, the muscles that are associated with the neck and the pharynx and the larynx will help with swallowing. So I'd mentioned that when you swallow, the larynx actually moves up, the epiglottis covers up this area here, which is the glottis, to prevent that food going into the airways. Intrinsic muscles, again, help control tension of the vocal cords and affect, whether or not that glottis is open. Now, I just erased some stuff, so I wanted to show you that if you look at something on a sagittal section, you should still be able to identify some of the cartilage that you saw from the anterior view. So here, this here is representing that thyroid cartilage. Here, this is your cricoid cartilage. Now, this structure right here, this part of the thyroid cartilage, which you see right in the middle, that's actually referred to as your laryngeal prominence. And the laryngeal prominence is like your Adam's apple, which is obviously more prominent in males than females. That's often why you can tell, unless someone had surgery to kind of remove part of it, is if you have, say, a male who's dressing up as a female, if you notice a very large Adam's apple, then you might be able to like, okay, that's actually a guy that's dressed up like a girl because it's very prominent. But you can have surgery to kind of remove that so it's not so obvious. Now let's go back on this model so you can kind of see this sagittal head model. Is again, you see the thyroid cartilage right there. Here's the cricoid cartilage. Now the top here is the vestibular folds. True vocal cords are here, and in the middle is your glottis. Here, right here, is the epiglottis. Okay. So let's now look at, once you pass the larynx, we're going into the trachea. So all of this is the trachea. And what you have here are tracheal cartilages. And they refer to them as C rings. The letter C, C rings. The tracheal cartilages are composed up of hyaline cartilage. That cartilage is going to protect the trachea from collapsing. It's, supports the airways from being collapsed. Now, the trachea is lined by PCCE, so we're going to continue to help to warm, humidify, and moisten that air. Now, what you get down to this point right here, where it branches, that's the carina. And what you'll see right there and right there are your primary bronchi. You have a right, this one is the right primary bronchus, this one is the left primary bronchus. Now they're called extrapulmonary bronchi because we have not entered the lungs yet. Now it's very important that you say right primary bronchus or left primary bronchus because there's a difference between the right and the left. Now what's going to happen is that these bronchi are going to branch again. And in the right, you have 3 secondary bronchi. In the left, you have 2. So here is 1, 2. Those are secondary bronchi. In the right side, you have 3. There's 1 right here, there's 2 right there, and there's 3. The reason is you have 3 lobes in your right lung. You have 2 lobes in your left lung, and these are the ones that are going into the respective lobes in that part of the lungs. Now, once they branch again, what you're going to see, these are going to be called tertiary bronchi. So you have primary, you have secondary, and you have tertiary. It's important mainly to know that you have 1 of each primary bronchi, 1 right, 1 left. The secondary, you have 3 on the right, 2 on the left, and the tertiary I don't mind if you remember how many numbers you have because I don't even know. Now, these will continue to branch at some point. What we're going to end up is not having bronchi. We refer them as bronchioles. So it's going to further branch, and they're going to be microscopic. But the bronchioles, one of the things I want you to realize is the bronchioles will not have any cartilage associated with it. So I'm going to go back here. Is you see a lot of cartilage. So actually, when you start branching more, just little plates of it. But once you get to bronchioles, there's no cartilage. So the cartilage is there mainly to again protect that, keep them from collapsing. So without the cartilage, now we have a greater potential for collapse. What I want to do first is kind of look at the lungs. So here you're seeing the right and left lung. So the right lung has 3 lobes because I said you had 3 secondary bronchi. Here's a superior lobe, you have a middle lobe, and you have an inferior lobe of the right lung. That should be real easy because that's basic anatomical terminology: superior, middle, inferior. On the left lung, you only have two lobes. So here's the superior lobe. Here's the inferior lobe of the left lung. Now what you'll notice in the left lung does have this right here. This is the cardiac notch because the heart would normally be sitting here kind of at an angle, and so it has little room for the heart. Now the lobes are actually separated by fissures, kind of like deep grooves. And so let's look at the naming of the fissures. So if you look at the right lung, you have a horizontal fissure because it's running more horizontal. Do it this way. This is the horizontal fissure of the right lung. And then you have an oblique fissure because it's running at more of an angle. So this is the oblique fissure of the right lung. In the left lung, since we only have two lobes, you only have one fissure. So in the left lung, you just have an oblique fissure. So if you had to identify this, you would say, if I had this tagged right here, you'd have to identify it as the oblique fissure of the left lung. So you can't just say oblique fissure, okay? Now, if we look a little bit deeper down into the lung tissue, is what we're going to have, actually, I'm going to go back here, is you see all the branching. And then once you get to here, you notice there's no cartilage. So those are bronchioles. So one of the key things when you do histology in lab is trying to determine if you're looking at a bronchus or a bronchiole. Bronchus will have a little piece of cartilage. Bronchioles will not. So here we have bronchioles, but they're going to terminate into these alveolar sacs, which are big sacs of alveoli. And what you see all in here, all these little alveoli through here, or we'll see it better in lab, is I'll show you kind of a respiratory bronchiole and how you're going to be able to tell that it's a respiratory bronchiole. So we'll look at that a little bit later. But I'm going to just look at this right in here. So here is so here would be a bronchiole, and you see a lot of smooth muscle associated. So one of the things that we'll notice is as we're going down the trachea, what we call the tracheobronchial tree, because it looks like an upside down tree. The trachea is the trunk. Is the amount of cartilage will diminish, but we'll start to see a lot more smooth muscle. So that smooth muscle is going to be important. The smooth muscle is sensitive to certain things, and if we cause that smooth muscle to contract, that can reduce airflow. If it relaxes, that will help to increase airflow. So it's so important to understand that the smooth muscle is sensitive to certain things which can affect the diameter of your airways. Now down here, we have a big old alveolar sac right here. And you see the alveoli right in here. And the alveoli are lined by simple squamous epithelium, which is really important for gas exchange. One layer of flattened cells. That's what we want. Those alveoli are actually just completely covered, and they don't show it on all of them, so you can see some other stuff, by blood vessels. That's going to be very important with the gas exchange. The oxygen needs to go into the blood. The CO2 needs to go from the blood into the alveoli so we can exhale it. Now you'll also notice is all these looks like little rubber bands that are surrounding the alveoli. So each one of these little balls is an alveolus. And what the little rubber bands are representing is elastin fibers. Now, they're going to be very important in expiration. When you inhale, these get stretched out. And when you stretch out a rubber band, what does it want to do? It wants to go back to its original position. So the recoil, or the elastic recoil, that results after you inhale is going to allow air to leave the lungs passively. So you don't usually have to work to exhale. Now, some people who've lost elastin fibers, like people with emphysema, they're actually going to have to really work to try to exhale. It's going to be harder for them to get air out of the lungs. Now, also on this picture, you'll be able to see, I'm going to erase it so you can see a little bit better, is remember your serous membranes. Your lungs have pleura associated with it. This outer one that lines the cavity is the parietal pleura. So remember, it is mesothelium. That's the epithelial tissue. And then it has areolar tissue. That's part of it. Because serous membranes, the membranes have an epithelial tissue and a connective tissue. And these are what compose up the pleura. So the parietal pleura, then here would be the visceral pleura, which actually lines or covers the lungs. In between, which they've exaggerated. In real life, it's not this big. We've seen here, this here is actually your pleural cavity. What's in there is like a teaspoon of fluid, of serous fluid. That's going to be very important in breathing. So when the rib cage expands out, this here is going to be stuck to this layer here, and the lungs come along for the ride and allows you to expand the lung tissue, because there is no direct connection of the lungs to the thoracic wall. The only place it's connected is up here. So this kind of allows you to couple the lungs to the thoracic wall. So you got that visceral pleura, you got the parietal pleura, in between is the pleural cavity, which has some serous fluid. It also protects, when you, the kind of the rubbing, so you don't have any abrasion there, any wear and tear. So it's a little bit of protective function. So this is going to be the end of just the introduction to the anatomy of the respiratory system. In lab, we'll look at the histology, and we'll talk about some other things in lab.